Before Canada and BC were formed, Indigenous peoples lived in balance and interconnectedness with the land and water in which the necessities of life are provided. Health disparities persist, which are due to the impacts of colonization and indigenous-specific racism. Healthy lands, healthy people. Island Health acknowledges and recognizes these homelands and the stewardship of Indigenous peoples of this land. It is with humility we continue to work toward building our relationship.
We feel like we're on the cusp of something different at Island Health. We're taking this time to take a step back, see what's working, and recognize how we take the next steps differently.
We have to start at ground zero. Because I think you probably heard those words, indigenize policy. We should indigenize. What does that actually mean? If we don't know, don't attempt to do that. Start from the beginning. And I think we have to be brave, and we're going to have to take risk.
And a lot of this work isn't necessarily comfortable, and that's okay. Understanding and deconstructing privilege and systems of privilege is hard work. It requires attention and intention, and to be able to really step in and understand is the first step to us being able to dismantle those systems of colonialism and privilege that keep some in and some out.
Don't be a bystander. We need to role model the way for our staff and our physicians, and it's not just about learnings or courses. It's about how do I speak up? When I see racism or when I see someone being treated with less than our values and compassion, how do I speak up and step in?
The idea of sitting down and truly understanding the impact of where our First Nations people have been and what they've gone through is something that I think we all need to take the time to understand. So it gives us that sort of just recognition of where we are as a society.
The more that we keep on this journey, the more it will settle in and really impact us. And hopefully that we'll be thinking about this every day as a human being in the way that we conduct ourselves.
To truly deliver our vision of excellent health and care for everyone, everywhere, every time, we know we need to make systemic changes within the system and embrace cultural safety. One of our key priorities this year is to embed cultural humility and cultural safety into our daily practice, starting in our emergency departments.
ERs have been identified as places where racism exists and has existed. And I'm just proud of being able to be part of working on that with my staff and with the patients in our community.
And there's nothing more powerful than us as leaders stepping into this space and saying we do have the power to change those conditions that best support our frontline teams to do their best work, and to do that best work through a lens of cultural safety and cultural humility.
We do this for those seeking care today, knowing we need to put sustained and continued effort into unraveling the inequities for Indigenous people, seeking safe care for the future, for tomorrow, and into the years to come.
Thank you.